Good morning. I wanted to make a quick video talking about the next step, the second to the last step in the all-in-4 process that I'm using. So to flip you around, here's the case we're working on. The last step for this patient was a wax tryin. It looks like the wax has been slightly beat up just a little bit, contoured quite a bit. I had to reset these teeth myself. The tryin that had come back from the lab was the teeth were positioned too far facially, and it just didn't look good for the patient. It didn't match her current temporary, which amazingly, the temporary denture that she's been wearing is really pretty amazing. Well, let's talk a little bit about her clinical situation and some pluses and minuses of how this procedure went. So, she has been missing her upper teeth for quite some time. She had a bunch of teeth that were basically falling apart. And so I did this surgery myself, start to finish. Numbed her up. She did not need anything other than a little bit of nitrous oxide. In looking at this case and looking at how her jaw comes together, I think we could have done more bone reduction, especially in the upper anterior region because of where her smile line is. But you can see the posterior left here, the maxillary tuberosity comes down quite a bit, and the same thing on the right side. She's got kind of a distal rotation of her maxillary bones. So potentially we could have done a little more bone reduction there that would have given us a little bit more favorable prosthetic outcome. However, it's turning out just fine. So let's look here. Here we've got the gingiva. We've got the multi-unit abutments. The two posterior ones here are angled. The anterior ones are not. These are straight. This one is quite submerged. But it's working just fine and the patient hasn't had any issues. We could potentially increase that by 1 millimeter in height or something like that if we wanted to down the road. Anyway, so this is what she presented as for the second to the last appointment. Again, the wax tryin, and this is the second wax tryin that we had done. So you can see I've got some blue marks there from adjusting the occlusion, which I'd always recommend doing in the wax tryin. It saves you a lot of time. I think I made a little video about that. Adjusting it now because the lab, essentially with the temporary prosthetic, the tryin, will scan and replicate the wax tryin. So in the end, I'm going to see if I can do this with one hand. Sorry, I don't have a mount for the camera. Her occlusion is good. She does wear a lower partial, but it doesn't. It's not working really well for her, so we're going to be remaking that once we finish the prosthetic, but we're running into an interocclusal arch space distance there, especially on the left side. And you can see during the processing or maybe shipping, some of these teeth broke off. Anyway, so there's the wax tryin. Here we have the provisional implant prosthetic, and this is from Glidewell. I've used them for quite a few of these. This is an acrylic. It's a printed acrylic that's got a lot of shine on it. But you can see these two are essentially identical, except, the materials they're made out of. So let me flip these over a little bit. You can see how they look. One is, of course, acrylic, printed acrylic here on the front, and then the posterior one is a denture base plate. We've got multi-unit abutments. I'm sorry, the temporary cylinders in here. And this is an ideal situation would be exactly what the final prosthetic looks like, except this is acrylic, the final one will be zirconia. So when we place this one on, get that to engage just right. Oh, I'm not getting it there. There we go. So again, this should be something that mimics the wax tryin. And again, kind of ignore the broken teeth down there. So, in the end, the patient will wear this for a couple of weeks. We will do some adjusting probably on the bite, hopefully not too much. If we have to do a whole lot of adjustment on the occlusion on the provisional prosthetic, then we're going to have to send it back to the lab so they can scan it in preparation for manufacturing the final restoration. However, if she wears this and is happy with the aesthetics and the fit and the shape, then we're in great shape. So one of the things that I did do, since we're talking about it, is I added some height to this anterior flange. With the lack of bone reduction, as I mentioned, in this anterior area, with her high smile line, we wanted to make sure it covered a little bit. So that's a little more concave than I would like. We'd like that to be more convex, but we have to make sure that it's totally covered. So, great case. I'll try to report on what the final turns out to be, but this is, again, the temporary tryin that she'll wear for a couple of weeks, and then we'll order the final, so she'll probably be in this maybe for a month or 6 weeks. Thanks. Bye-bye.